Should I start? Good morning, everyone. I, Surbhi Negi, am going to present a topic on psychosexual stages by Sigmund Freud. My moderator is Dr. Ayushi. About Sigmund Freud, he was an Freud. About Sigmund Freud, he was an Austrian neurologist, and some of his contributions are he was the father and founder of psychoanalysis. So, what is psychoanalysis? According to the topographical theory of Freud, there were three minds: conscious mind, unconscious mind, and pre-conscious mind. In the unconscious mind, there are things which we can recall. And in the unconscious mind, there are distressing memories which we cannot recall. And in the nice, so I'm just explaining. And in the pre-conscious mind, there are things which are difficult to recall, but we can recall them. So pre-conscious mind prevents these distressing memories from coming to the conscious mind. So through the interpretation of dreams and through free association, we can bring these contents of conscious mind into the unconscious mind, and thus we can treat the mental disorders. Psychosexual development, according to Freud, we have an innate tendency to seek pleasure, especially through physical stimulation of parts of the body that are sensitive to touch, called erogenous zones. These shift of the erogenous zones occur as per the age and stage. Freud believed that personality develops through a series of childhood stages, during which the pleasure-seeking energies of the id become focused on certain erogenous areas. So what is it? Let us understand id, ego, and superego here. I'm giving my example. So it is based on the pleasure principle, and ego is based on the reality principle, and superego is based on the morality principle. So I'm here in internship. So my ego will tell me, my id will tell me that I should enjoy my internship, and my superego will tell me that I should study hard and not take any break. And my ego will make the balance between the id and the superego. Then this psychosexual energy was described as the driving force behind our behavior. So what is fixation? Attachment to an old stage, even after moving on to a new stage, is fixation. If the child's need at one of the psychosexual stages were either unsatisfied or oversatisfied, then the child shows continued attachment to an old stage, and this results into problematic behavior patterns in the future. So this is the pictorial representation of fixations in various stages. When there is fixation in the oral stage, then in the adult personality, person develops smoking, gum chewing, nail biting. And if anal fixations, then he develops orderliness, obsessiveness, and rigidity. And if phallic fixations, then he develops vanity, exhibitionism, and pride. Then the 5 psychosexual stages. First is oral stage. Birth to, here it is written 1 year, but it is still 1.5 years. And anal stage from 1.5 to 3 years. Then phallic stage 3 to 6 years. Latent stage from 6th year to puberty, and genital stage from puberty till death. First stage is oral stage. Oral stage is from birth till 1.5 years. In the oral stage, we seek pleasure mainly through mouth. If too much or too little gratification occurs during this stage, an individual may become fixated at it. Oral drives consist of 2 separate components. First is libidinal, oral erotism. This predominates in the early parts of oral phase. Then the aggressive component, oral sadism. This is mixed with the libidinal components in later phase. And oral aggression expresses itself in biting, chewing, spitting, and crying in child. If there is a successful resolution of this oral stage, then the child develops sense of trust on others, sense of self-reliance and self-trust, And if there is excessive oral gratifications or deprivations in the oral stage, this results in libidinal fixations. And this further results in some pathological traits such as narcissism, that one thinks too highly of oneself, dependency on others, envy, jealousy, and smoking and overeating in the adult personality. Then this is the pictorial representation for pessimism and optimism, smoking, overeating, and nail biting. Then we come to the second stage, anal stage. In the anal stage, this is from 1.5 to 3 years. During the anal stage, the process of elimination becomes the primary focus of pleasure, that is control of bowel and bladder movements. If the parents are too strict or begin toilet training too early, then the person develops anal retentive personality, and he develops these traits: orderliness, stubbornness, willfulness, frugality, and obsessive compulsive disorders. So this is the pictorial representation for anal retentive personality. First is obsessive compulsive disorder, second is orderliness, and third is stubbornness. And if the parents are too lenient on the toilet training, then the person develops anal expulsive personality, and he develops these traits: lack of tidiness, messiness, defiance, rage, sadomasochistic tendencies. What is sadomasochistic? That a person derives sexual gratification from inflicting pain on oneself and on others. And what is ambivalence? That inability to decide on anything is ambivalence. So this is the pictorial representation for traits with anal expulsive personality. First is anger, second is ambivalence, the person cannot decide which part to take, and the third is messiness. And if there is successful resolution of anal phase, then the person develops a personal autonomy, that is the power of self-government, self-determining behavior without a sense of shame or self-doubt, lack of ambivalence, willing cooperation without either excessive willfulness or sense of self-diminution. And there is shift from passivity to activity. So how the stages shift from passivity to activity? In the oral phase, the child is dependent on others. And in this anal phase, when he develops the sphincter control, then he comes to the active phase. So this is the phase of activity. Then we come to the urethral stage. This stage was not explicitly treated by Freud, envisioned as a transitional stage between anal and phallic stage. So this stage shares some of the characteristics of anal and some of phallic stage. The predominant urethral trait is that of competitiveness and ambition. Urethral competency provides a sense of pride and self-competency derived from performance. Resolution of urethral conflict sets the stage for budding gender identity. Now we come to the phallic stage. Phallic stage is from 3 years to 6 years. In this stage, the child's erogenous zone is the genital region. The child becomes more interested in his genitals. He begins to discover the differences between males and females, and some of the critical episodes for development occur during this stage. These episodes occur differently for boys. For boys, it is called Oedipus complex, and in girls, it is called Electra complex. Now we come to the Oedipus complex. So who was Oedipus? Oedipus was a Greek king who, unconscious of his identity, married his mother. So this Oedipus complex occurs in boys and have predominantly unconscious fantasies of sexual involvement with the opposite sex parent. Boys begin to view their father as a rival for mother's affection. The Oedipus complex describes these feelings of wanting to possess the mother and desire to replace the father. The child also fears he will be punished by the father for these feelings. So this is termed castration anxiety. So so the child starts identifying with his father, and after identification with father, it reduces anxiety in child. He behaves like his father and takes his ideas of right and wrong. Then there is Electra complex. Electra complex occurs in girls. Girls are attracted towards their father, notices that she does not have the sex organs like her father and brother, and she also has fear of being castrated by mother. This makes child angry, and she starts devaluating her mother. Identification with mother with the feeling that, so she identifies with her mother with the feeling that she will stand better chance. So if there is successful resolution of phallic stage, this provides foundation for an emerging sense of sexual identity and sense of curiosity without embarrassment, initiative without guilt, sense of mastery, not only over objects and persons in the environment, also over internal processes and impulses. Then we come to the latency stage. In the latency stage, the sexual drive during this period is quiescent. This is the period of primarily homosexual affiliations for both boys and girls. In this, the sublimation of libidinal and aggressive energies into energetic learning and play activities. Here, the child explores the environment and become more proficient in dealing with the world. And this relative quiescence and control of instinctual impulses allow development of ego apparatus and mastery skills. So what is ego? Ego is basically the reality principle, which balances the id and the superego, which is the pleasure. Id is the pleasure principle and superego is the morality principle. So this is the pictorial representation for latency stage. The child is active in studying, playing, and homosexual affiliations. So the danger in latency period arises from the lack of control. If there's lack of control in the latency period, there's failure to sublimate energies in the interest of learning and development of skills. And if there's excess of control, then there is premature closure of personality development, precocious elaboration of obsessive character traits. So we come to the final stage, that is genital stage. Genital stage is after puberty, when there is physiological maturation of systems of genital functioning. There is intensification of libidinal drives and regression in personality organization. This reopens conflicts of previous stage of psychosexual development, and this provides opportunity for resolution of these conflicts to achieve a mature sexual and adult identity. If the previous stages are not resolved, so these stages can be resolved in this stage. If there's failure to achieve successful resolution in genital stage, this provides unsuccessful and fixation in various phases, produce pathological defects in emerging adult personality. If there is successful resolution and reintegration of previous psychosexual stages, this leads to a fully mature personality with capacity for full and satisfying genital potency, self-integrated and consistent self of identity, self-realization, and meaningful participation in areas of. Thank you.
Good morning, everyone. I'm Sumani. I'm presenting the mirror neurons presentation. My moderator is Dr. Astha. Okay, so we start by wondering, why do we experience an ouch moment when we see sports and see someone falling? Or why do we feel the pain seeing others crying or watching emotional movie endings? The answer is probably the mirror neurons. So the discovery owes as much as to serendipity as the skill. While in 1980s, Giacomo Rizzolatti and his colleagues found that some neurons in the premotor cortex area of the macaque monkeys, called the F5, fired when the monkeys did things like reach for or bite a peanut. To know more, they further used electrodes to record the activity of neurons while giving the monkeys different objects to handle. The motor neurons that fired on giving a peanut were surprisingly the same neurons that also fired when the monkey itself grabs the peanut. So here we can see this was the experiment they did. So both the neurons that fired during the monkey seeing the action and doing the action was same. from monkeys to humans. So the next step was to look for these neurons in humans, as attaching electrodes directly to the human brain was not possible that time. So they could not record the activities of single neuron. So the first study was examining of the hand twitching in 1995. Bizzolatti and Luciano Fediga recorded motor evoked potentials from participants' hand muscles as they watched the examiner grasp objects. These matched the potentials recorded when the participants actually grasped the object themselves. Similar studies were done in 2003 where participants inhaled noxious odors like the butyric acid and viewed an actor wrinkling up his face in a disgusted face. Both feeling disgusted and watching someone look disgusted activated the same area of the brain. In another study, tactile empathy was studied where same area of the somatosensory cortex was active, both when the participants were touched on the leg with the feather contraption and when they viewed someone else being touched on the same spot. So this was not just the action, but feelings too, as Marco Iacobini did functional MRI studies of emotional faces, concluding that same neurons fired when we imitated a face seen on a picture as well as when you just look at the picture, suggesting that the mirror neuron system sends signals to limbic and emotional system of the brain as well, allowing us to empathize with people. So growing up as children, first you see and then you do. This is also through the mirror neuron system. Through the process, we develop a rich pieces of knowledge that we can apply to perceive pain and emotions of others and not only just their motor actions. When we see, we experience. So finally, the mirror neuron system was defined as a network of specialized neuron groups that discharge when an individual performs an action and or observes an action of another agent. The location of mirror neurons is the ventral premotor cortex, the inferior frontal gyrus, the inferior parietal lobe, and the superior temporal sulcus, which is the key area of mirror neuron system in our brain. Functions, imitation, action understanding and learning, and also social implications like the empathy, emotions, and face gestures. So example of imitation, this example is very commonly seen in every home where small babies are made to imitate opening of mouth so they could be fed easily. Thus, the actors and mimicry artists have a very developed mirror neuron system for the virtue of imitation. Second example, the action understanding. Here we can see like the human mirror neuron system needs a visual input where we can see a man reaching for a cup. So we have observed this thing. Then the mirror neuron system imitates this in our own brain where we imagine how I would make the same movement. And after this, we understand it, why did the other person did that action. So we have finally understood the action that he wants to have a sip of coffee. The clinical implications, a reduction in the mirror neuron activity may be involved in the pathophysiology of psychiatric conditions that are characterized by social cognitive deficits like autism, schizophrenia, and psychopathy. Empirical research has argued an association between negative symptoms of schizophrenia like anhedonia, affective flattening, and impaired socio-emotional processing, and abnormality of the mirror neuron system activity. Observing reduced brain activity during the task related to empathy, that is emphatic deficit. In psychopathy, there is the emotional empathy is impaired while the motor empathy and theory of mind is intact. While in autism, emotional empathy is fully intact, but the motor empathy and theory of mind is deficit. So one thing we use the mirror neuron system for therapeutic purposes, mirror therapy. Here we create reflective illusion of an affected limb in order to trick the brain into thinking that movement occurred without pain. That is creating a positive visual feedback of limb movement used in improving motor function after stroke, phantom limb pain, complex regional pain syndrome. So this is the therapy where reflection of the opposite normal limb appears in place of the hidden limb, creating artificial visual feedback through the mirror neuron system. Conclusion, so the mirror neuron system is considered to be related not only with motor imitation and reading intention of other agents, but also with the concepts and social interaction such as emotion, empathy, and theory of mind. So we can now understand why do people in the same room keep yawning because of the mirror neuron system. Thank you. So that's an article published that it's so this one. So not the motor is deficit. So from neurons to social being, short review of mirror neuron system research and its social, psychological and psychiatric implications. So it's from
Okay. I was actually wondering about this guy. Is the autism fully that I'm not very sure. We have studied that. They are saying that he's feeling and he's not expressing. I have to go and read. Seems a bit strange.
Motor empathy and awareness.
He gets it. But few things that you guys want to ask first provide. Often exams to that. It was not there. How शॉर्ट वाला बच्चे रिजोल्यूशन कैसे होता है क्या तो आप वो their slides for
Problem is you have to wait for a question. One last question is those.
the
So, you can stop this. I think